education. I teach classes on behavior management and assessment and verbal behavior. So I have been lucky enough to work with Dr. Doris Hill and Maria Gutierrez on this project for 2 years. Very kind of them to invite me to join them on this adventure that we've had. And Dr. Hill.
Good morning, everybody. I'm Doris Hill, and I'm the director of the Regional Autism Network and an associate professor, associate research professor in special ed, rehabilitation, and counseling. And I'm very excited that we were funded for this project because I think it's very important. And Dr. Drew and Maria and I feel like we're a pretty good team. And having the YouTube channel makes it accessible to a lot of people who may not be able to come to our live presentations. I want to thank our interpreters, Mr. Reed and Ms. Baker, for being here today. I did put the surveys in the chat. I noticed people are still coming in. So once Ms. Jones gets started, I'll go ahead and put it in one more time. And on that note, I'm going to hand it over to Maria.
Oh, Maria, you're muted.
Thank you. Good morning, everybody. I'm going to take a minute to assist some of our Hispanic families. Maybe they need help being connected into the interpretation channel. Si usted está atendiendo esta plática y quiere escucharla en español, puede seleccionar el icono de la parte de abajo de la pantalla y seleccionar el idioma español para poder escuchar a los intérpretes. We also will have this presentation with language access in Korean next Friday. So we are happy that you are attending, and we hope that you could join us as well on Friday. So my name is Maria Gutierrez, and I am the Family Navigator for the Regional Autism Network. We are region number 4. Over 20 counties, and we are so excited to have Kelsey today with us so that she could go over some of the myths that sometimes we hear, you know, regarding where we have a bilingual child in the home. So thank you for being here today. And Miss Kelsey.
Absolutely. So I'm going to go ahead and start our presentation here. And then we will jump right in. So I do want to say at first, if any of you are coming in with questions today, there are things that you want to have answered by the end of this presentation. I would encourage you to go ahead and put those in the chat now, because in our questions segment at the end, I want to make sure I answer those questions first. So go ahead and put those big questions in now. And then as you have questions as we go, please feel free to add those also. So, like Dr. Drew said, I am a bilingual speech therapist with experience in building bilingual programs in elementary schools and also in private practice. So I'm here to tell you a little bit about what I've learned as I practice in this field. So I graduated from Auburn with my master's in communication disorders back in 2016. I also have a Bachelor of Arts in Spanish and a Bachelor of Science in Communication Disorders from Auburn. So I've been practicing for almost 6 years now. And right now I live in Mobile, Alabama. Me and my husband live here, and I work in a private practice. So the first thing I kind of wanted to go over is, what is a speech therapist? Our formal name is a speech language pathologist, called an SLP or a speech therapist, sometimes a speech teacher in schools. So we have lots of different names. We have a minimum requirement of a master's degree, and then we have our national certification through the American Speech and Hearing Association, and then also our state licensure wherever we live. So we can work in hospitals, schools, nursing homes, private clinics, lots of more locations. And we focus on these 5 areas below: speech disorders, language disorders, cognitive communication disorders, swallowing, and then social or pragmatic language disorders. I'm going to break those down for you just a little bit so you can understand a little bit more about what these words mean. A speech disorder would be like speech sounds. So we have some children who can't say their R, can't say the L, or can't say an S. sound. So those, that's one category. Another one is fluency, or someone who may stutter. And we also have voice or resonance disorders, where the structure or function of your vocal cords or the passages between your nose and your mouth don't function like they should. And so we have some disorder there. Language disorder is a lot of what ends up being a lot of what we do, especially working with children. So we work with what people understand, or their receptive language, and what they're able to say, or their expressive language. And we look at those two things separately. Some children understand a lot, but can't quite put their thoughts into words. Other children have difficulties in both areas. And so we work on those two things together often. These language disorders can be spoken, they can be written. So kids may have a hard time, or adults even, putting their thoughts into written word. And then we can look at the form of language, which is the basic breakdown of how the sounds form words, and then the grammar of it. Or we look at the content, which is like the vocabulary or semantics, and then the use of language, which is those pragmatic or social language skills. And we also have social communication disorders. Sorry, I'm reading through these questions kind of as we go. Perfect. So we have social communication disorders, which is often seen with our students with autism. So difficulty with the social use of verbal and nonverbal communication. So as you all know, a lot of what we say doesn't come from the words. It comes from our tone. It comes from our body language, eye contact, and all of those things vary from culture to culture. So for example, gestures can mean different things also. Pointing may be perfectly acceptable in some cultures. In some cultures, it's very rude. Standing very close to our communication partner might be acceptable in some cultures and not in others. So those are the nonverbal things that we look at. And so we use that nonverbal communication and verbal, the social part for social reasons, for altering a message for the listener. For example, I'm speaking very differently to you than I would be speaking to a 2-year-old, or that you act very differently in a job interview versus playing with your kids when you're at home. So there's that altering the message, following the rules for conversation and storytelling. That's something that we work on a whole lot as speech therapists with kids, is how to form a good story that has a clear beginning, middle, and end, that is easy to follow, that uses those words like first, then, and last, so we can follow how that story is building. Like I said earlier, these social communication or pragmatic problems are often related to autism spectrum disorders or other medical conditions like a traumatic brain injury. We see that a lot with our car accident or work accident victims who, after their injury, have a hard time maintaining that social appropriateness. Ooh, there we go. Then we have our cognitive communication disorders, which would be problems organizing thoughts, paying attention, remembering, planning, or problem solving. So this happens a lot with our students and adults with ADHD, that we work on what we call them executive functioning skills. So they're the higher level thinking and planning. The example that I like to give is if you were planning a wedding and you have 100 family members that are going to be at this wedding, and you know that Uncle Leo cannot sit anywhere close to Uncle Mike or something bad is going to happen. But Uncle Mike also doesn't get along with Aunt Vera. And so you're doing that complex problem solving, try to figure out where all these pieces fit in. And those are the things that we work on a lot with these types of disorders. You can see this because of a stroke, traumatic brain injury, or dementia. But like I said earlier, that can also be because of ADHD or other developmental disabilities. And lastly, swallowing disorders. Which the medical term that we use is dysphagia or just say ja. You will hear it said different ways. So that would be feeding or swallowing difficulties, which could be from illness, surgery, stroke, or an injury. We see this a lot also in our clients with autism, that they have some sensory feeding difficulties. They may only prefer soft textures or only prefer crunchy textures. And there's a lot of aversion there towards anything that isn't comfortable with feeding. Or they may have a primarily liquid diet because chewing the food is not something they're interested in doing. So a speech therapist can also help you in an area like that. And I want to say too, I'm going to pause for a second or two between slides to give time for our interpreters. If y'all need a little bit more time from me, just shoot me a message and I'll try to slow down. Okay, so now I want to talk about some terminology that we use a lot when we're talking about bilingual children. Bilingual in and of itself is a complicated term. Are we talking about an adult that speaks 2 languages? That's typically how we think of the word bilingual. Or are we talking about a second language learner, a child that was raised in a predominantly Spanish speaking household that has now gone into a predominantly English speaking school? That's what we would typically call a second language learner. I prefer the term second language learner. It feels more inclusive to me. But I am and was a second language learner. I grew up in a predominantly English speaking household. I learned Spanish in school, and then I studied abroad in Spain, and then have worked in a probably 50-50 English Spanish setting for most of my career. So you'll hear those 2 terms used frequently. You will also hear simultaneous versus sequential language learning. So my example, I am a sequential language learner. I learned English until I was, I guess I was first introduced to Spanish, maybe in preschool, then also in high school. So probably started Spanish when I was 14. So I am purely sequential. I learned English, then I learned Spanish. And another example would be a simultaneous language learner. I have a client whose dad is from the US and the mom is from Russia. So the child that I treat is learning English at the same time as they're learning Russian with their family. So that would be a simultaneous language learner. Next, the terms interference and transfer. So when we're talking about how a child learns language, especially as a second language learner and a sequential language learner, so first one, then the other, we hear these terms used somewhat interchangeably, but they do mean different things. And I want to highlight that. Interference implies that the first language is negatively impacting the second language. But almost everyone in the world that speaks a second language speaks with some sort of an accent or difference because of the impact of their first language. And so the term interference for me, I find bothersome, I guess would be the word, because it seems negative. Transfer is the word that I like better, because we all, like I said, we all speak our second language with an accent, our third language, our fourth language, whatever that might be. And so it's natural for the first language to somewhat impact the second language. I'm going to go into this section particularly in some more detail further on in the presentation. So if you have questions about that, I'm probably going to cover some of it later. And then the last thing for this slide is difference versus disorder. That is the #1 job of a therapist, especially in dealing with our bilingual students or adults. Are we seeing a difference in their communication because they speak 2 languages, or are we seeing a true disorder where there's something in the system that is not working like it needs to, that needs to be intervened on? This child needs therapy in order to raise themselves to the level where they could be. Or in order to raise themselves to the level of their peers. And that is, it's a complex question, especially when I'm sure many of your kids are serviced by English-speaking teachers or therapists. And so that's something I'm very passionate about, is teaching our monolingual teachers and therapists how to spot those differences. So we are not over referring our bilingual kids into the special education system. It also happens the reverse way, where people will say, oh, they're just behind because they speak Spanish at home, which is often not the case. So we see it on both ends. We see that kids are over referred, that they're given extra supports in schools because people think they're behind because of the second language, or the reverse. They blame them being behind on the second language. And so I'm going to help talk you through some of those things today to make sure that you can advocate for your kids and say, I really think this is only, I really think there's more here, or no, I think my kid's doing fine. Okay. Whoops. I do want to stop really quickly and answer one of the questions that's come up. So one of the questions was, my child only eats macaroni and cheese. Can a speech therapist work on that? Will it be covered by medical insurance? Every time I try to introduce a new food, my child gags. So going back to the swallowing disorder question earlier, insurance is very complicated. I cannot answer that question for you. It depends a lot on what insurance provider you have. It also depends on where your child is getting services. Generally in a school system, they will not work on this kind of sensory feeding for complicated reasons. A private practice speech therapist, either at a hospital or a private clinic, could definitely help. And the coverage by medical insurance would be depending on your policy. So I would highly recommend that you reach out to your insurance company or talk to your child's doctor and ask for a referral to a private clinic or a hospital that provides services in the area, and they should be able to help you work through that insurance issue. Okay, I'm going to go ahead and move on from there. Okay, so I'm going to talk here about these two different kinds of language proficiency. Before the presentation got started, Dr. Drew was saying how she was working in a school system and she speaks some Spanish, but they pulled in the lady who worked at the front desk because they figured that she would have the Spanish proficiency to help translate this meeting with parents. And that was an assumption that there's one kind of language proficiency, which just isn't true. We have two different kinds. We have the basic interpersonal communication skills, which is we refer to as BICS, B-I-C-S. And then we have CALP, cognitive academic language proficiency. The BICS language skills, we can normally get in about 2 years of consistent exposure to a language. Think of this like grocery store conversation. How's the weather today? I need new bananas. My bananas are old. I'd like a sandwich for lunch. Or did you see the sports game last night? Those very highly contextual, embedded conversations. You're talking about something that is right in front of you. And that is much easier. We also have and I don't mean easier in terms of proficiency. So it's a simpler form of language, like I said, highly contextual, and you can get that in about 2 years of exposure. CALP is the academic language. It's what you learn in school as you're studying, how to discuss math problems, how to do a math word problem, standardized testing, reading and writing. So this requires 5 to 7 years of consistent exposure to a language in an academic setting often to be able to have these higher level conversations in our second language or our first language, really. It's how you see language develop in a monolingual child too. Simple, easy stuff first, talking about, what they want to eat for dinner, where's their favorite toy, when's daddy coming home. That's BICS. The CALP is that academic language that requires so much more exposure. So with the story from Dr. Drew earlier, there was an assumption made that because the person spoke Spanish, that they had this academic language in Spanish, and that assumption was false. it requires academic instruction in a language or a lifetime of using it with study to be able to use these higher level language skills. And so that is important to think about because, if your child is predominantly speaking Spanish at home, it's going to be normal for them to need some exposure in English to be able to talk about all of these complex things, to be able to start, doing math and reading books and talking about what they've read. So that is a normal part of language development. There's absolutely nothing worried about there. Ooh, sorry. See? Whoops, going the wrong way. So some school systems do have a measure to address BICS versus CALP. I would highly recommend, I know there's some professionals in the group here today. Bilinguistics is a wonderful website. It's a company based out of Austin, Texas that primarily focuses on bilingual therapy, not just Spanish, but they also have some Vietnamese and other language. I think they actually have some Korean information also. They offer a 12-hour CEU course, a continuing education course called a Certificate of Cultural Competence. I'd been practicing as a bilingual therapist for years, took the course, learned so much. So if any of you have any questions about some of the more in-depth practice level things, I'd highly recommend looking into bilinguistics. And they have a checklist that I've used in schools before that looks at BICS versus CALP skills that parents and teachers could fill out. Oh, thank you, Dr. Drew. That's wonderful for putting that link in the chat right there. They also have great information for parents. Most of it is in English, however, just forewarning. Okay. Oopsie. Okay, so now the big question, right? What's typical? How do I know if my kid's behind? That's a question that monolingual parents ask, bilingual parents ask, every parent asks. What's normal? So let's kind of talk about what those normal checklist skills are. So in early language, studies after studies have shown that in typical language development, kids acquire the early language milestones at a similar rate and order in many languages: English, Spanish, Italian, Japanese. We go from single words to word combinations to more complex structures. That's how the progress goes. I'm sure a lot of you saw that in your kids. They first learned how to use one word, started adding the second one, and then you start getting the questions, the denials, and the longer phrases. Bilingual kids have roughly the same number of words at each stage as their monolingual peers, because we have to consider overlapping and unique words. For example, your child might have home words primarily in Spanish. So talking about favorite toys, talking about favorite foods, talking about activities that you do at home, that vocabulary might be in your home language. But then they go to school and they start talking about basketball in English. They start talking about favorite TV shows in English. And so we have those unique sections of words. Sometimes there's two buckets. We have Spanish words and English words, for example. But sometimes those buckets are connected because we'll have a kid that has apple. They can say manzana. They can also say apple, or shoes. We have shoes and zapatos. So that counts as two words for this kid. They know it in English, they know it in Spanish. So that's what we mean by unique and overlapping here. Okay, so what is normal in terms of early language? Number of words. 12 to 18 months old, we want first words and 2 to 6 words other than mama and dada. Often that will be favorite toys, pets, siblings' names. If they have a bottle or a blanket they love, they might have a name for that. And it's not going to be the right word. Blanket might be bubby. That might be what they call their blanket. That counts as a word. If they love If they love cookies, they could call cookies yetas. Not the right word, still counts because that's a consistent word that they're saying. So 12 to 18 months, 2 to 6 words other than mama and dada. At 18 to 24 months, we're hoping the goal typical is that they have 50 words. So they are saying 50 specific words consistently in the same way, and that they can understand 150 to 200 words. So around this stage is when they can follow some pretty good directions. You can say, hey, go get your shoes, or where's your ball? And they probably are starting to be able to answer yes, no questions. Do you want a cookie? And they might nod their head yes, or say the word yes. And then at 24 to 30 months, we see that they are saying 200 to 300 words with early word combinations. So before age 3, at about 2.5, we're seeing some 2 words. It could be more ball, more cookie, no mama, go swing. So early verbs, simple verbs, and then some of those 2 word combinations to really start to express what they want and often what they don't want. No seems to be one of the first words for all kids regardless. So then at 30 to 36 months, we want kids to have 450 words that they can use. So by age 3, our kids are using 450 words with more complex combinations. Kind of a general rule of thumb that I like to tell parents is up to age 3, you want 1 word per year. 1-year-olds can say 1 word, 2-year-olds can say 2 words at a time, 3-year-olds can say 3 words at a time. So these are the basic things that you're looking for when your kids are real little, to think, okay, how do I know if they're on track? This is the basics here. Had a question just come up about language norms or the typical use in teenagers. That is a lot more complex. The easiest way to get that probably is to have that child sit for a standardized assessment with a speech therapist or a psychometrist or a psychologist to see how their vocabulary and grammar is developing compared to their peers, because there would be so much information that's needed there in terms of verbal speech especially. Okay, so this, I more wanted to add this chart in just to kind of show you the difference. We were talking about transfer and interference a couple slides ago. And so I wanted to show you the differences in sound acquisition by age. So if we just look at the English side of this chart for now, this is the age that we expect kids to master sounds. We were talking about those speech disorders earlier. So at age 4, kids should consistently be saying M, N, H, W, B, and P correctly in words. For example, mama, that M is consistent, or noodle, that N is consistent in that word, the N sound. So if we look at the typical for English on one side, the typical for Spanish on the other side, we can see that these sounds develop at different ages. So looking just at English skills for our Spanish speaking kids, you can see that, for example, let me look at the predominant difference. Okay, in Spanish, kids typically can say the L sound correctly in words most of the time by age 4. If you look over at the English side, it's not till 7.5. So that's a huge difference in age we're looking at here, which is why it's important to evaluate kids in their native language when we're looking at not only language skills, but speech sound skills. And a lot of that is because your tongue moves differently for those of you who speak English and Spanish. When we say the L and the R, especially in English and Spanish, that the muscle movement is different. So this is just sort of to illustrate the languages, the sounds come at different ages. So we might be holding our Spanish speaking kids to unrealistic standards in English because they haven't had the same exposure to those sounds. Okay, same kind of thing here. We call this a phonetic inventory. What sounds are there in a language? For our Spanish speaking families that are here, you know that there's a lot of sounds in English that Spanish just doesn't have. That's all of the ones on the right side of this Venn diagram. The TH sound, the sound, j, v, sh. So, so we see those sounds are separate. The ones in the middle are the ones that are shared. And this is why we have that transfer or interference that people call it. It's our accent. Most people that speak a second language are going to pull the sounds over that they're comfortable with from their native language, just naturally. And so we need to think about how these sounds are different as a speech therapist to be able to tell, is the child that we're looking at speaking differently because of their language background, or do they truly have a disorder? Are they having difficulty with sounds? And so when we are evaluating in a school system, in a private practice, although especially in a school system, we want to hear how kids talk in different parts of the school. We want to see how they interact with their peers. We want to see what their language and speech is like when they talk to their teachers. We want to see how they play on the playground. So we look at language and speech and all of its different settings to see if there's a breakdown more in one place than another. Maybe they're just very quiet in front of their teacher and they're shy in that big group setting, but then you see them with their friends and they're just talking. So we want to look at those skills in different places. Okay. For our Korean families that are here today, I wanted to also include this information to see, so we could see the difference that happens in Korean versus in English. There are many sounds in Korean that don't exist in English and vice versa. And I'm not going to even attempt to butcher what they would sound like because I don't speak Korean. But we have to think about those differences regardless of the language, the home language of the child. Okay. So now I'm going to jump into the kind of myths section about bilingualism. We've talked about this a little bit, but just to go through all of the misinformation that's out there. And at the end, I'm going to share some accounts with you, like on social media, that do a really great job of publicizing these myths, especially from a family perspective. So y'all can kind of build a community around you. There's several speech therapists that I follow that I would highly recommend following. So common myths that children will learn are their second language, which is often English, more slowly if the native language is spoken at home. We know this is blatantly false. The United States has such an insular mindset when it comes to second language learning, when actually we are the minority. Most of the world grows up speaking more than one language. All over Europe, all over Africa, all over Asia, and they are doing just fine in terms of language development. So continue to support that native language at home. And then the second one, the second is that a child should completely learn their first language before they start speaking their second language. Once again, if you look at the models in other countries in the world, kids learn 2 languages all the time. There are many areas of the world where children routinely speak 3 languages. For example, when I studied in Spain, I taught English classes to 5-year-olds, and there was 0 Spanish spoken in those classes. at age 5. And those kids did just fine. They were exposed to English from the time they were 2 or 3. And by the time they graduated from high school, they were balanced bilinguals. They spoke an equal amount of English and Spanish. So the third is that mixing 2 languages in one sentence or conversation is a sign that the child is confused. All right, for our 2 language speakers in the room, how often do you speak 2 languages in one sentence? All the time? Me too. If anything, we call this code switching. If anything, it's a sign of intelligence. We code switch all the time. It doesn't even have to be between languages. You go from, let me think of a good example. Okay, here we go. So you're talking right like I am here right now. I'm giving a formal presentation. I'm talking to grown-ups. I'm using my presentation voice. If my dog or my child walked in the room, I would immediately change my register. I would go to mama talk. I'm code switching for the other being that has walked into the room. I know that something has to change in my conversation. The same thing happens with people who speak 2 languages. Maybe because you're supporting your vocabulary, you can't remember how to say, I don't know, tire or something. And so you say, oh yeah, you know, the tire on my car is broken. But instead of saying tire, you say, oh, the llanto on my car is broken. You put that word in there, and it's perfectly appropriate. Or maybe we do it for emphasis. You know, you're speaking English, but there's that phrase in Spanish that just puts that extra like zing on what you need to say. And so you put that Spanish phrase in. We do it all the time. They're not confused. If anything, it's a sign of intelligence. Parents who only speak their first language will not be able to raise a bilingual child. Also not true. There's lots of people who are completely English speaking that raise a bilingual child because they have supports in their community that teaches the child the second language. The Vietnamese speaking nanny, the Spanish speaking teacher, the camp that they go to every summer where they learn Mandarin. Plenty of, heck, me. My parents did not raise me bilingual. I'm a pretty decent bilingual because I wanted to learn Spanish and now I do. So even if you only speak your home language, your kid can still be wonderfully bilingual, but it will take supports in your community to support both of those languages. And you have to be that first language support, especially if you live in a community where there aren't many people who speak your native language. If you don't speak it to them, they're not going to speak it. So you are their language support there. You can most definitely have a copy of this presentation to give to the teacher at school. Please, I would love for you to. And there's plenty of research. I have at the very last slide is a list of the articles and websites and things where I got information for this presentation. So look them up and use them, please. I highly encourage you to. And tell them about the Bilinguistics Cultural Competence course. It's like $70. It's fantastic. Everybody should take it. Okay, and then the last one. If a child goes through a silent period when they start learning their second language, they're going to forget their first language and not learn the second one. No, they're just absorbing it. Kids are like sponges. But the beautiful thing about a kid's brain is it's a limitless sponge. But when they start to get that second language coming in, they might be more quiet for a little while because their little brains are making sense of everything that they've had put in. They're still understanding everything that you're saying. They just might not be talking as much as they were before. We, as grown-ups, probably have periods in our lives where we're quieter than we used to be. We're overwhelmed with work. School has gotten really hard. We have a sick family member. Those are stresses that impact adults, but we continue to be fine even though we're quieter. So don't let the silent period scare you. That typically happens with much younger children too. We're talking like age 2, 3, 4. Okay. Okay, so what are some advantages of being bilingual? This was a really fun slide for me to come up with, by the way. Advantages of being bilingual. There have been many studies that have shown positive effects on the brain for bilinguals versus monolingual people. Better attention span and better multitasking. Just like I was talking about with the code switching earlier, your brain is keeping up with two things at once. Your brain is getting so strong. Your brain's like a muscle. It needs exercise. So it gets stronger when they speak two languages. We see an academic advantage, less distracted, more focused, improved performance in their second language than their monolingual peers. Study after study. We see economic advantages because you speak two languages, you're doubly as useful for your employer. Almost every job I've ever had is because I speak a second language. And I know it's slightly different because, well, gosh, the way that Spanish is growing at such a rate where it's the most common second language in the country. We're having more and more people that need not only services but support in Spanish. So, man, if they could just think of the economic advantages that you're giving your kids by continuing to support their home language. We also see health benefits like those positive effects on the brain from earlier, delayed onset of dementia, improved stroke recovery, lower overall stress levels, which also reduces your likelihood of stroke. Of course, this is for once you get to be grown, but there's also an increase in open-mindedness because you've been exposed to more than one culture, most likely. We all know that everybody needs to be a little bit more open-minded these days. Once you learn two languages, it's much more easier to learn a third. So that's another great benefit. You see the social benefits because those doors are open. You have double the people that you can interact with and be friends with. And lastly, like I said earlier, bilinguals are the majority. We just happen to live in a country where it's not valued as much as it should be. So there are so many benefits to encouraging bilingualism. Ooh. Okay, so I know this has been a whole lot of information and a lot of kind of lingo, but I'm going to get through this last couple slides of kind of the dense information, and then we're going to jump into some more fun stuff. So what are the differences in our bilingual language kiddos and or adults? So we expect differences in kids that speak two languages, regardless of their language proficiency. So we see that kids that are native Spanish speakers are going to speak English with an accent, and vice versa. Has anybody ever listened to a high school kid trying to speak Spanish when they're learning it in their classroom? Talk about an accent. It's normal, completely typical. These differences can be seen in word order, the speech sound use, which is what we would call an accent, word choice, and many other things. So these things are normal. Like I said, for the 15,000th time, it is normal for the speech of a second language learner to be different than a monolingual speaker of that language. Normal. But what if you think that the differences they're showing are not normal? What do you need to be looking for? The kind of warning signs that maybe your kid does need some support. Okay, when should you be worried? These are like the 7 kind of red flags. There are more, but this is kind of the big hitters. That they're having trouble learning both languages with support from you and other caregivers and their teachers at school. So their Spanish isn't progressing like you would expect, nor is their English, if you're a Spanish speaking family at home. If you have a family history of learning difficulties, we don't know exactly why this is the case, but there is some genetic factor in learning difficulties. So if you have family members that had difficulty with language, regardless of the number of languages, that's something to think about. If they're developing slower than their siblings or cousins, that's something to keep in mind. You know that, older sister was, speaking in sentences by the time she was 3 or 4. But now little sister is still only using one word at a time at 3. Oop, sorry about that. So yes, somebody just asked a question. Can this language delay be something that runs in families, that their mother-in-law said that their spouse didn't speak until they were 7 and all of their kids have been late speaking? Absolutely. We don't know why. We don't know why that's inherited, but it does seem to have a genetic component. If they have unusual error patterns, so we all know that when kids first start speaking a language, regardless of the language, they have that babiness to their speech. There are certain sounds that they mess up. In English, for example, a lot of kids can't say their R sound until later. And so they'll be talking about wabbits. Everybody knows the little kids say wabbits. That's normal. We don't really worry about a kid that says wabbit. If we hear a child say bobbit for rabbit, that's unusual. We think, never heard that one before. So, kind of compare to other kids that you've been exposed to and see if there's anything unusual there. Different speech skills than other people with a similar language and cultural background. So this is kind of similar to comparing to their siblings. If older sibling had the same language background, started speaking English when they went to school, exposed on TV before, everybody spoke Spanish in the household, but you're the second or the cousin or whatever isn't rising at the same speed. We want to pay attention to that. They have a hard time playing and talking to kids their own age or similar age. If you notice, they're not engaging with kids their age. They don't know how to do that play. That's something we really want to look at. And then difficulty with language and routines. We humans are routine-oriented people. If you think about how you get dressed every day, you probably do it in the exact same order. If you think about what you do right when you get up in the morning, you probably do it in the same order every day. Your kids know that. So bath time routines, meal routines, getting up and going to school. If you notice that they have a hard time following along in those routines, so you say, okay, let's go get in the bath, and nothing, that's something that we need to think about. Okay, so we see these things, we see some of these things, or we're just worried. What now? You have the right to write to your child's school. You have the right to request an evaluation just like the teachers do. It is a federally mandated program. It's a federally mandated system. You have the right to request an evaluation if you're concerned. You can call the school and say, hey, I'm worried about Johnny. He's not speaking like I think he should if your kid's in school, and ask for an evaluation. If that doesn't work, write a note. My recommendation is that you keep a copy of every note that you write with the date on it. Take a picture with your phone, something like that, so you can have proof that you have reported your concerns. And if they don't do anything about it, you can always request that evaluation yourself. Write a letter to the school saying, I want an evaluation for my kid because I'm concerned about their speech and language. Sign it, date it, take a copy, take a picture of it, and keep it for your records. Because once you formally request an evaluation, that sets a federally mandated timeline going. It starts a clock for the school system. And unfortunately, sometimes we have to hold people accountable. The system is not perfect. I've worked in public schools. And so I've been one of the people that got notes requesting evaluations. So don't feel bad about having to ask. You can also call the school system main office and get in touch with the special education department if your letter has not been responded to within a reasonable amount of time. You can also talk to their doctor. Go into the pediatrician, whoever their primary care doctor is, and tell them, I don't think they're meeting their milestones like they should be. And then ask for a referral to a speech therapist in a private practice or in an outpatient clinic. If your kid is under the age of 3, Alabama's early education system is there for you. I highly recommend reaching out to earlier intervention. I thought I had included that phone number, but you can, all you have to do is Google early intervention in Alabama specifically, and there's a 1-800 number that you can call there. If they're over the age of 3, then you can go directly to the school where your kid is zoned to go for elementary school. Of course, with COVID, it's slightly more difficult because they're not just letting people walk in. But once they're 3, then the school can and will provide services if your child does qualify. Okay, sorry, I'm just scrolling through to see if there's anything I'm going to go ahead and answer right now. Oh, here's a good one. Okay, should the school provide a copy of the speech report to the parents? They usually share numbers that mean nothing to me. I'm so sorry to hear that. Yes. So a copy of the evaluation report should be given to you. I'm not sure how it works in Alabama. In Texas, a parent had to sign the evaluation. And all of that should be documented very clearly in their IEP, that you saw it, that you understood it, and you are good with moving forward. So I'm assuming that they're giving you progress reports with numbers, because that's generally what would happen. And so, oh, thank you. Ms. Gutierrez just put the link in for early intervention. Yes. So, so this is something that is a problem regardless of language history. Professionals are very good at using professional words to describe what they've done. Sometimes they have a hard time explaining what it actually means. So what? That's my favorite question to kind of give the professional part, and then so what? Why does this impact my kid? And what are you going to do about it? So you can always ask for a meeting, either with the principal, with the teacher, with both. Once they're in special education services, you're kind of the driver of the bus. You're in charge of what happens with your kid, even if it doesn't feel that way. You can always ask for a meeting. You can always say, I need to understand this better. Ask for a translator to help you explain, to help you understand what it is they actually did. Assessment should always be standardized. Sometimes, because of language history, it's not possible to do a standardized test, which means, so a standardized test is scored on a bell curve, which means that 100 is the average, and then you have a range of normal around 100. If they don't have the means to provide a standard score because they don't have a test that's normed in Spanish or normed in Korean, they may not be able to give you a standardized number, but they should be able to clearly tell you why your child needs services or why they do not. I know this is a lot of information. I wish I could talk to all of you about this one-on-one. That would just make life so much easier. And so an informal evaluation of speech is kind of what I was talking about earlier. You're looking at checklists, you're talking to teachers, how they're performing in school, you're talking to parents to see, what are your concerns about how they communicate well or don't communicate well. And so that's the informal. There's not many numbers involved there, not really scores. You're saying this is what we have going on. This is what we see as a problem, or this is what we have going on. This is why it's not a problem. A formal assessment is numbers. They give you a standard score. They give you a percentile rank, which says, how they compare to their peers of the same age and language background. So most of our assessments here in the US are in English, and they're not normed for our bilingual speakers. We do have some wonderful assessments that are coming out because we're seeing this more and more. And so there are standardized assessments. Many school systems don't have them or don't know that they need them. And so, but kids should be evaluated in their native language, period. If they don't have the ability to do that, then they at minimum need to have a, what's the word I'm looking for? A formally trained and licensed translator that is translating those assessments and then giving the speech therapist or whomever detailed information about how that child's or adult's speech differs from what is normal in their language. I hope that makes sense. So some of the good standardized tests that we have out now, of course, this is my personal opinion. These are the tests that I use, that I really like to use. For our older kids, we have the BESA, B-E-S-A. It's the Bilingual English-Spanish Assessment. It was created by Dr. Bedoya and Dr. Pena, I think, who are at UT Austin in Texas. It's a wonderful assessment that actually looks at bilingual kids that have been learning English and Spanish. We have some assessments that are normed on predominantly Spanish-speaking kids, which a lot of our kids here are a very mixed bilingual. They have probably almost equal amounts of exposure in Spanish and English. And so we have to take that in mind also. Okay, so this is really, okay, I think I'm gonna mix it up a little bit. So I'm gonna wait and save this last little bit of the presentation for the very end. And I'm gonna jump in and actually answer the questions that we have in the chat. And then at the end, we'll talk about language development in the home. So I'm gonna stop my share so I can actually see all of your faces and get a good view of who's here. Okay, so let me pull up the questions that we've had, and I will go through and see if what I've answered and what I haven't. Okay, so one question was, do we take a specific certification to address social skills and children on the spectrum? And no, not really. The field of speech therapy is very wide. So we quite literally, when we graduate, can treat from birth to death. We have a complete scope of age, birth to 99, say. You can choose to specialize in a certain area, but if you're like me, I've worked in every area. I've worked with babies, I've worked with elementary school kids, I've worked with high school kids, I've worked with adults, and I've worked in nursing homes. So there isn't a specific certification, but there are specific trainings that people can do. And we have a requirement to do a certain amount of continuing education every year through our state and our national organization. So we are doing training. And then how do you know how much speech therapy a kid should get at school? Who gets to decide? I don't think my child is getting enough. They only get 30 minutes a week. He's limited verbal and 7 years old. 30 minutes a week is relatively standard for school systems because speech is considered a support service. So with the idea being that speech is provided as an additional support for the already language-rich classroom, and that school is intended for kids to be in a classroom setting. So the speech therapist generally makes the original recommendation for how much speech your kid gets, but you can agree or disagree. Some of it is a question of resources, and but you always have the right to disagree with a plan that they suggest, which I know is uncomfortable, but you can. So I know that that's a hard question to answer. Okay. So there's a question, I kind of already went over this, but if the child is primarily Spanish speaking and he's 5, should speech testing be given in the primary language? Yes, it absolutely should. Like I said earlier, even with either with a translator with an English speaking assessment, or with an assessment that is geared, that is normed and created in Spanish. Another important thing to think about is that a conversational assessment is often very informative, especially with a 5-year-old. So working with an interpreter that is used to working with a speech therapist is enormously helpful, because they know what they're looking for, and they know what normal is for each age in a language. Okay, so we have another question about IEP goals. I've seen one IEP goal for my child, but he has many needs in this area. How realistic is it to work on only one goal per year? That's a complicated question to answer because I can't see the goals in front of me. If we're talking about speech therapy, generally there is one umbrella goal, and then there are several small things that they're working on underneath it. And that would be ideally based on the results of their evaluation, what their needs were, or what the teacher and the parent have communicated as their primary concerns. And here's a question: why does it seem easier for kids to learn English than Spanish once they start school? If I'm reading this question right, I find that a lot of kids that regardless of their language background, if they have a highly supportive Spanish-speaking family at home, in a Spanish-speaking community, English is the language of entertainment. They watch TV in English. Their friends at school are speaking English. And so that is the highly rewarded language for them, because it's how they're talking to their peers, it's how they're making friends, it's how they interact with the bigger world. So kids tend to be very excited about speaking English and sometimes not as interested in speaking Spanish at home. But that doesn't mean you should stop, because they're still hearing it. So even if they're not actively speaking it as much, because they probably will, decide that they want to go back and they're interested in speaking Spanish again, if they haven't heard it in years, they've lost all of that good exposure that you're pouring in. How to help a child at home that stutters. I would highly recommend looking into, what's the name of that website? Let me look it up real fast. I think it's the Stuttering Foundation. Yep, this is it. Okay, if you go to stutteringhelp.org, I believe they have some translated resources into Spanish. Dr. Drew, would it be possible if I can find the resource, can I email it, or Maria, can I email it to y'all and then you send it out? Okay, because there is a website that has Spanish information, but I can't remember what it is offhand. So I'm going to make a note and I will send that on.
Diane does a
But
great job of sending like a summary email with the materials and questionnaires and all of the stuff. So we can just pop whatever it is right into the email.
perfect. But stutteringhelp.org is a wonderful website. And I will work on finding the one that's in Spanish because I know there's one. Okay. When is it too late to provide speech therapy to correct nasal speaking? It's never too late. It's just kind of like learning to ride a bike as an adult. Think about learning a new motor skill. Like if anybody has learned to play tennis as an adult, learn to ride a bike, learn to, I don't know, throw darts. It's very hard to learn a motor skill. Speech is motor. So you can learn it as you get older. It just might be a little harder than when you were younger. I would really recommend a speech therapy evaluation, especially someone who has a background in more of a medical lean to speech therapy. There's two sort of flavors of speech, some that's more educational based and some that's more medical, because if there is a significant nasal issue, it could be structural. It could be that they need to see an ear, nose, and throat doctor. So I would highly recommend a speech therapy evaluation in that case for that nasal speaking. Okay, and then this next question, my child speaks way too fast, almost in one breath, and we lose context. How can I help her? Me too. I talk way too fast. I would model that speech. Humans are mirrors. We mirror what we see and hear. So if you can, even without even saying, okay, I'm going to talk slower for you now. Try to take your tone and take your rate down, and see if she starts to mirror you. Not robot slow, but slow and easy, and see if she can mirror your rate there. But that would also be great for speech therapy. So we do that too. Okay. So this question, can you talk about language acquisition for students with intellectual disabilities with very limited verbal? How should a school address his needs? Once again, that's a very complex question, not knowing the child and not knowing the situation. But what I would say is, that is such a hard question to answer without knowing the kid and without knowing your family and the school situation. So I would kind of think about it like I mentioned earlier. We have two different language inputs. So home, and I'm assuming, is predominantly our second language. You're mostly speaking second language at home. School is mostly speaking English, I would assume, unless they have a need there, or unless they are having support language there. So, I mean, I have a lot of questions about that question. Are they using like a communication device? If so, those can be in two languages. So like a talker, an iPad, or a dedicated system where the kid's touching buttons to talk. Those come in both languages. You can easily toggle back and forth. Are they using like a picture symbol where he's touching what he needs? Those are usually just a pictographic picture representation, like a picture of a potty if they need to go to the bathroom. That would be easy to go back and forth between languages. So that it's kind of hard for me to answer that question with the information that I have in front of me. But whoever asked that, if you want to give me a little bit more detail, I can see if I can help you out. Okay. All right, I think I've gotten through all the questions now. So now I'm going to jump kind of into some modeling of what language support looks like at home. I'm going to do it in English. It's easier for me to do it in English, but it's easily translatable because it's all just play. Play is the basis of language, regardless of age. And so, but especially with our younger kids, elementary school aged. So I have some toys that I really like to play with here, and I'm gonna show you kind of how I would play if I had a kid here with me, and show you how I would use these tools, which are toys, to support language. But continue to jump in and ask questions as you need to. Okay, so I'm gonna move. Okay, here's a question. Okay, so how can I support my daughter who has problems with speech, language, or with speech receptive and expressive? She also has a support or diagnosis of intellectual disability. So, about to show you. So let me angle my screen down, and I'm just going to kind of play on my desk and talk like I'm doing therapy with a kid, non-existent kid that's not here. I was going to make my husband pretend to be the kid, but I figured this would just be better rather than that. Okay, so bubbles are one of my favorites. I would highly recommend buying non-toxic bubbles. They sell them because inevitably kids will eat them. It just is going to happen. They're going to eat them. So highly recommend buying bubbles. They used to make these cool 3D bubbles that stuck, but I've never been able to find them again. So with bubbles, we can do so many things. Kids are so motivated by them. We can use lots of verbs. So the things that we think about first are more, open, and go. Those are 3 high value words for kids. Think about all the stuff they can communicate to you with those 3 words: more, open, go. Huge. We can also use them in routines. Kind of like I mentioned earlier, routine language is so powerful because you do it over and over and over again. If I say ready, set, the next word is obviously go, right? So we can monetize on that expectation, and use that word almost like an exclamation. Go, big happy. So when we're playing with bubbles, we're gonna do woo. We're gonna say pop, 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 pop. We're talking. We're always talking. We say, uh-oh, oh, more bubbles. Okay, we're gonna close them. I close them between every single turn. Most kids can't open these, especially the little bitty ones. So I close it really tight and I just put it on the table. Okay, what are we gonna do? And I wait. You don't have to be talking the whole time. You can wait, place that pressure, let that expectation build. They're gonna be so excited. What do you wanna do? And then we say, oh, you want more. Okay, open bubbles. Ready, set, go. And then we pop, pop, pop all over again. So we always want to expect one more thing than we know they can do. So I have a kid who has no words, who points and looks at things that he wants. And he goes, all the time. That's all I get. So the first thing I'm going to do is one word or a sign. I love sign. Kids learn sign so quickly. So we do baby sign. We do more. And so I help them with their hands. More. Oh, you want more bubbles. Once they can do that sign on their own, and I know they can, I want one more thing. I want them to do, I want them to make the sound with me. More bubbles. So we're raising the expectation for them, because that's how they learn. They learn contextually in play. They learn what they're looking at and what they're thinking about. Bubbles are a great, great toy. I'm not sure so this question, CAPD, I'm not sure what CAPD is in this context. Can somebody give me a little bit more information so I can answer? Oh, auditory processing. Thank you. Oh goodness. So if we have a child that has trouble with auditory processing and also visual, that does make things very complicated, because we have most of how we learn is through seeing and through hearing. And so we have to figure out how we can support their auditory system. I guess, are we talking about a kid that has both, that has auditory processing and visual, or is this two separate things? Because if it's both, then it does make things very complicated. Both. Okay, so we can think about using brightly lit toys. I didn't bring any of my light up toys with me. I have some maracas that light up different colors, some tambourines that light up. Baby toys often have lights that go when you hit buttons. And so we want to think about how to bring in input that they can interact with, and that shows them cause and effect. So especially with little bitties, we can, the small kids, we want to teach them that an action leads to a result. Word gets thing. Sign gets thing. Yelling does not get thing. Crying does not get thing. So we're teaching cause and effect, which is why so many baby toys, they push a button and the thing pops up. Cause and effect. It's the exact same as words. So that's a very early building block to work towards words. Another great thing to think about is exclamatory words. Woo, wee, beep, beep, oh, crash. Because those are very low pressure words. So next toy. Simple car track. This is one of my favorite toys. I could do therapy probably for a whole day, regardless of the kid, with this thing. It is super, super valuable because it's very motivating. So one of my favorite things about this car track is it has doors. You know, I love the word open. We open, out, car. This is how I would talk to a kid, obviously, not to you. So car, okay, ready? Hold on. Ready, set. Remember, we're waiting. We're building that anticipation, hoping they're going to say, go! Oh, uh-oh. What happened? Uh-oh, it's stuck. Go! So we're using all of these loud, big, happy, easy words. Because we want to give them all of that good input. We are very engaged in their play. So we have some kids who don't want to play with us. They want to play with their own stuff. They want us to play with our stuff. Fine, don't care. I have more than one car. Also, side note, I keep things where kids cannot reach them because I am the source of fun. I don't want them to be able to get their own fun. Otherwise, they'll play by themselves for 45 minutes and they don't care a lick about me because they can get all their toys, right? So that's why I only have 2 out. My thing has 3, but the third one lives in my pocket because I have one and they have one. And we're going to play with these cards beside each other. If they're pushing them, you know, so many of our kids are fixated on wheels. We love to watch wheels go. So we're going to go and we're pushing. That's all we're doing with this car. We're just pushing it back and forth. Some of them don't even care about the track. They don't. It's just not motivating because they just want to watch the wheels. And they can't watch the wheels on the track. So they're spinning. We have so many that just do this, right? And just want to look at their wheels. But I'm going to play with them. Parallel play counts as play. I'm playing with my toys, you're playing with your toys. I'm talking about what I'm doing the whole time. So, you know, Johnny's over there playing with his car. I'm having so much fun playing with the toy that eventually he's interested. It's like, oh, wait, she's having a really good time over there while I'm over here fixated on my little wheel that's not making any noise. So I'm going to go loop myself in to this. Ready? Go! So, source of all fun. Other thing I love. This is, so the last 2 slides in the presentation, when y'all, I'm not going to flip back over to them because I can talk about it all without the slides, but that's all the examples of how to do this early language therapy. So it doesn't matter if your kid is 5 and in the early language stage, or if they're 1, or if they're 10. If we're in the early language stage, this is how we play. And really, it's kind of how it works for forever. We just kind of make it more complex as they get older. So I love clear bins, especially clear bins that kids can't open. These are cheap, and so they're very easy to open. But some of my little bitties still can't quite figure it out because they can see all of this fun stuff in here, but they can't get it. And so guess what? We get to say open or more or go. All of those are first words that I really work on. This is a set of wind-up toys that I bought on Amazon. Let me think. 4 years ago-ish. Paid $13 for them. It came with like 25. They're sold as like Easter somethings. I also have a Christmas set because I just like Christmas. Wind-up toys are high value toys for our little ones because they can't make them go on their own generally. It's hard to turn our little thing. And so we do the same thing. We have the verbal routine. Say, oh, okay, we want more. And then I have it wound up. I'm holding it. I'm not letting it go. I'm just gonna wait. We want more. Okay, ready, set, go. And he goes hop, hop, hop. And he's gonna hop, hop, hop until he turns off. And then they have to ask for more again. They'll try, they'll pick it up and they'll be like, fiddling, but generally can't do it. So movement toys, especially toys that kids can't play with on their own, is such a great way to work on early language development in your home. For auditory processing disorder too, we want to keep things simple. Long sentences, you lose me in a long sentence. I like to keep it simple, not baby talk, but simple. Think about those function words. You have a blue ball or blue penguin. Not, oh, look, there's a blue penguin over there in that box that we could go and get. Oh, blue penguin. So we try to keep things simple. Okay. I asked some of the other therapists that I work with in my office, if you had to show parents how to play, what are the things that you would want to show them how to play with? Because play is a skill. You were never taught how to play. It's my job to teach people how to play. It's fun. It's exhausting. So I got a couple requests. So puzzles. We love puzzles. Puzzles are very high value toys, especially now. They make those puzzles that make noise when you put the piece in the right hole. Oh, we love those. Melissa and Doug make a lot of them. So let's talk about puzzles. My sister is an occupational therapist, and so a lot of these toys are hers because I ran up to the office this morning and raided her toy closet. So here we have a fish puzzle.
Kelsey, we kind of lose your audio when you move the screen.
Okay, can you hear me now?
You're a little echoey. It's odd.
All right, can you hear me now?
Still kind of echoey. It might be the
What about now?
there. Now we can hear you.
So strange. Well, thank you for telling me. Okay,
Yeah.
I'll do it like this. It just might fall out. Okay, so this is a fish color puzzle. So many parents and educators get sort of fixated on academic skills. Oh, well, he knows his ABCs and he knows all of his numbers and he knows his shapes and his colors. So he's fine. but that's all he can do is say blue or pink or A. We're not using words to communicate. We're just talking. So we want to use these if your kid is obsessed with colors, if your kid's obsessed with letters, use it. I have a letter puzzle that gets a lot of use in my room because so many of my boys especially are obsessed with letters. And so we talk about those letters, we ask for the letters. Yes, no questions are really fun with letters. And so we have a puzzle. And these are those peg puzzles. So the piece fits directly in the hole. There's a little peg. It's great for little hands. You can get sets of these on Amazon or at Walmart for super cheap. They hold up really well. They clean easily, which I also really like. They're chewable. Kids always chew on our puzzle pieces. But anyway, so we have all of our pieces. This is going to be loud. Excuse me. Okay. So we take all the pieces out of the puzzle. And we're talking about, okay, so this is for a little bit older, I guess, than basic. You say, okay, where's yellow? Is this yellow? No, this isn't yellow. This is purple. Okay, purple. Does purple go here? No, that's yellow. Okay, purple goes here. Yay, purple on. Let me wait. Do you want more puzzle? So we're always using that weighting, build the anticipation, make it fun, make their words powerful. So even if they only have more, if more is their only word, we're monopolizing on that. So they can say more all day long. Snack time. Think about, oh, I meant to bring some snack in here. So, if you normally give them a whole bag of goldfish, for example, they get their goldfish, they get their juice, snack time over. Think about making it a routine. Give them 3 goldfish. 3, that's it. And you act like nothing's wrong. Okay, here you go. Here's your snack. And they're going to eat the 3 and think, Mom and Dad have lost their minds. Where are my crackers? And so they have to initiate that communication. Do you want more? At first, it might just be, but still, they're communicating. They're telling you, hey, you're not meeting my expectation. Okay, so here's a question about a 15-year-old. What games can you use to teach him how to talk? So I'm guessing he's not talking much at 15. So whatever he's interested in. Kids learn from what they're interested in. So do grown-ups. Think about the things you learned in school that you don't remember anything because you weren't interested. You didn't care. Add math, not my thing. I don't remember any of it. I can't add 2-digit numbers because I don't care. This stuff, care about, could talk about it all day long. So monopolize on what he's interested in. If he's obsessed with video games, you can find every video game on YouTube. And you can talk about what's happening in those videos. You can use the things he's interested in. Routines are incredibly powerful because they know what's coming. They know the words that are associated with that routine. Snack time, meal time, bath time, getting dressed. We can talk about all of that and you can do it wrong. You can sabotage that situation. So for, I'm not sure if you're bathing your 15-year-old, but if you are, don't put water in the tub. And he gets in the tub and he's looking like, hello, something's wrong with this situation. And so he's having to say, hi, water or whatever, or he's, tapping on you and looking like we're missing a piece here. So we can think about using those highly contextualized, right in front of you things to learn. Because when kids learn to talk, if their first word is mama, they're not saying mama on purpose. They're saying mama, 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 and mama goes, oh, you said mama. Kid goes, oh, not completely like this, but man, she got really happy and good things happened when I made those sounds with my mouth. I'm going to make it again. Mama, mama, mama. Ma, you said mama. So the kid learns good thing happens when I say mama. Then they figure out, oh, she comes when I say mama. Her name is mama. And so that's how we learn all language. You don't learn that this is purple unless you're looking at it purple. Purple's not this like abstract concept. It's a color that you can see. And so we're talking about what we see right in front of us, what we're doing right in front of us. And so we figure out how to use the things that they're interested in to make them interested, to win them. It's a game. We're trying to figure out how to trick them into working in a lovely way, not in a bad way. Okay, so I have a couple of other toys that I can show you, but if y'all want, we can do some more questions right now. Because it seems like maybe some of you have some older kids. So if you have any other questions about older ones, we can do that now too.
Those, Kelsey, those are the questions that I sent you. Those are the ones that I have received. So
perfect. I think I've covered most of them. I am going to flip back over just to make sure that I didn't miss any of the kind of points that I wanted to talk about. Okay, so I covered a lot of these. I'm just going to kind of go back through so you can remember when you get this presentation and you can look at it. The +1 technique is if they say one word, you say two. They say more. You say, more cracker? Always one more. They say bird. Oh, it's a little bird. And so we're adding one more than they know, because we're building, right? We're building these skills. The 3-2-1 rule is huge. We ask kids so many questions. Questions are hard to answer, especially for our kids that are on the spectrum. Questions are freaky. It shuts them down. They say, nope, not answering that. But if we're talking about the thing, oh, we have cookies and we have crackers and we have cheese, let's have a snack. That's not a question. They're much more likely to engage and report in some way what they want when it's not a question. So think about 3 statements to 1 question. Not literally, but much more statements than questions. We put too much pressure on our kids with our questions sometimes. Use those verbal routines, like I said, and mess them up. Somebody knocks on the door and your kid knows, okay, they go answer the door when somebody knocks. Don't get up for, a second, and let them look at you and think, something's wrong here. Let them take on some of that responsibility of like regulating a routine. Put them in the bath with no water. Give them an empty cup if you know they're thirsty. So because you can use those situations to show them their action gets the thing. Even if the only thing they can do is poke you or, with their cup, So you give them an empty cup and they go, Communication, beautiful. Not a word yet, but you can model that word. Oh, you need juice. Mommy's so silly. She didn't give you juice. Okay, let's do juice. And think about those high value words. Like I said, self-talk. Talk about everything that you're doing. If your kid's around, y'all are driving down the road, you're going to the grocery store. Oh, look, I see a blue car. Oh, here comes a red one. Okay, we're going to the grocery store. Think we're gonna, talk, drive yourself crazy. Folding clothes, putting clothes on, cooking dinner. You can narrate that child's life and think of all of the words they're hearing. It's countless. Temptations, like I talked about earlier. That's why I love clear boxes. They can see it, but they can't get in it. Keep the toys on a shelf. I know it's annoying because they're going to unfortunately communicate with you a lot. But that's what we want, right? We want these things to be enticing and not accessible. So they have to tell you. And I know we have a lot of problem-solving children who will climb on chairs and countertops to get what they want. But still, think about keeping things in sealed containers. Take their snacks off the bottom shelf. Don't let them get their snack by themselves. If this is what we're working on, that basic communication skills, you need to be the source of all wonderful things for your kid. Withholding, same kind of concept. We have things in boxes that they can't get to. We have toys that they cannot engage on their own. So you are a source of fun. You are a source of good things. And not in a negative way. We're going to feed our kids. We're going to play with our kids. We're going to let our kids have toys. But think about how you can let their action get them the thing, because that's power. That is what communication is. Thing gets thing. Word gets thing. Sign gets thing. And then repetitive books and songs. I love them. I use them all the time. I have a hand washing song. I have a walk down the hallway song. I have a toy song. I have head, shoulders, knees, and toes, wheels on the bus. And kids learn that routine. So my hand washing song, I can't sing, but it's we are washing, yes, we are, now we are rinsing water off. And what you believe, in 2 weeks, those kids know the whole routine. They know exactly how to wash their hands, and they're actually washing their hands for a longer amount of time, because that's a thing that bugs me. So think about how to make those things up. Wheels on the bus, head, shoulders, knees, and toes, 5 Little Ducks. And most of these songs have Spanish versions on YouTube that you can learn and do yourself. If the video's there, odds are the kid's more interested in the video than you. So learn the song and do it instead of just having the videos there. Repetitive books are great for that same reason, because the kid starts to anticipate. One of my favorite ones, and I didn't bring it, is Bear Wants More. They're cute little board books. Like I said, a lot of these are available in Spanish also. And it's the line on every page is, he ate so much that his big tummy ached, but Bear wants more. And so the kids start to anticipate the rhythm, just like the verbal routines. Ready, set, go. Build that good anticipation there. Okay, so we've kind of gone through that. Talked about snack time, talked about cars, bubbles. Play-Doh is another great one. I know Play-Doh is messy. This is probably one of my most highly requested toys in my room. I have a Ziploc bag of cheap cookie cutters and a little plastic rolling pin, plates and spatulas. And so think of all the verbs that I can do in this bag. We can cut, we can roll, we can push, open, eat. Oh, eat's a good one. Pretend to eat the Play-Doh, pretend. So we're thinking about how to monopolize on all of their kids' favorite things to not only let them hear more language, but teach them that their words are where their power comes from. That they don't have to fuss and cry to get what they want, that they have the ability to use their words to get it. All right. This is a lot of information that I have gone through in very quick fashion. So I'm happy to answer a few more questions. I think we have about 15 minutes, 15 more minutes in our scheduled time for today. But if not, are there any professionals that are in the room that have any questions that they'd like to ask, or any resources that they'd like to share? Or parents with more questions?
Really quickly, I worked with a family who we were working on using pictures for communication along with a speech therapist. I am not a speech therapist, but to supplement, the young kiddo had a drawer that had all of the snacks in the drawer. and those were just kind of freely available. So what we did is we took the snacks out of the drawer, but on the front of the drawer, we Velcroed pictures of the snacks.
Yes.
So, crackers, cookies, all the different things. And then he was able to, he was already going to the drawer anyway, because that's where the snacks were. And so when they would ask, what do you want? And he would, they taught him to pull the card with the picture
Mhm.
on it. So it's just inserting the skill where there's already that, like you were saying, that motivation.
Mhm.
And that then led to having the cards kind of in other places. But that was a natural place to put the cards and to have them ready and available for him when he, rather than kind of being like, oh no, the cards are in another room or they're somewhere else. They stayed Velcroed to that spot. And that was
Yes.
really helpful.
Yeah, I love, so it's a picture exchange communication system is often what that's called. And a lot of times parents or other professionals are hesitant to use an alternative form of communication because they're afraid that it will make their kid not talk. And we see the opposite happen. I have a client right now who is, how old is he? 6-ish, maybe, 5 or 6, who has an autism diagnosis and previously only communicated with one word at a time, maybe 2. We started using a talker, so a high-tech communication system. It's called LAMP. I love LAMP. It is one of my favorite programs to use. It's automatically English and Spanish for those of you who know or who need that. And now verbally since we've been using this talker, so he pushes buttons to say what he wants. He's regularly speaking 3 and 4 words at a time. We took that pressure off. We removed the anxiety of verbal communication, and now he won't be quiet. He's talking all the time about what he wants to talk about, but still. So if you do have a therapist suggest that you try an alternative form of communication, don't be afraid that it's going to make them never talk. Oftentimes it does support that talking. Go ahead.
And I just want to say that that is something I've seen as well, and the research shows that part of this could be related to anxiety, like your student. It could also be that when you're using the talker, the person you're communicating with is also supposed to use the talker.
Mm-hmm.
So if we're having a conversation, he says goldfish, I then press the button for I want, and then I press goldfish. So I'm showing him what he would say in a longer sequence, and it's adding those words and adding those pushes. Also, as a parent, I'm not a parent, but I have seen lots of parents, when your kid comes to you and says goldfish, a lot of times you're busy, you're doing other things, you hand them the goldfish and they go and play. So that is a low language interaction. They say 1 word, you say 0 words.
Mm-hmm.
So there's no value added in that conversation, versus if you're using the talker, it may encourage you to say more words. And it just gives you that reminder of like, oh, when they say goldfish, I need to say, you want goldfish? Do you want a lot of goldfish or a few or whatever you're working on?
Yeah.
But it gives that enrichment that maybe when you're in your groove of just doing your parent thing, you're like, yeah, okay, goldfish juice, we're done. Rather than seeing that as that opportunity to say juice, you want, we have apple or orange, touch which one you want. Kind of, it gives you a bit of a reset for your interactions.
Yes, absolutely. And the same thing is true for verbal communication, like we said earlier. Think about the +1. The +1 is so valuable. I love how you said that, the value added. That's the exact way to think about it. You're adding value to their communication. You're also showing them you heard what they said, and you are recognizing that attempt on their part. You're reinforcing that language. Because humans will take the path of least resistance. And so we want to encourage that growth, encourage that development of more words. So 2 questions just came through. One, how will I work on social skills for a young person with autism to address taking turns while speaking and personal space? Oh my goodness. My 2 school placements ago for me, they called me the social skills police. This is one of my favorite things to work on. I love social skills. It's so valuable. So the way I think about it is it has to be done explicitly, which means what you and I would understand as inappropriate, they don't. So we have to explain why it's inappropriate with examples. And that takes a higher level of language understanding. So, my 3-year-olds that, have a recent autism diagnosis that don't have a lot of language, honestly, I'm not working on it yet. We need to have progressed to the point where we can clearly communicate wants and needs in some way, via a talker, pictures, words, sign, whatever, before we start talking about those social skills, because they don't have the skills to apply or understand those concepts until then. There is some recent controversy about whether or not we should be addressing social skills with our autistic students. The way I personally feel about it is that we can give them the tools to choose to use them or not. For example, when we have a kid who stutters, I'm not telling them to never stutter again. I'm giving them the tools to choose not to stutter if they want to. If at home they don't care if they stutter, it doesn't bother them, sure, go for it. But I want you to have the tools to not. Same thing with these social skills things with autism. That's my personal feeling about it. There's a lot of different beliefs, especially recently, about that. Do you recommend supplementing speech therapy outside school? That is highly child dependent. The one thing that I would say is there are 2 different scopes and purposes of therapy. School is educational impact. Is it limiting their performance in the classroom, or is it preventing them from accessing the curriculum independently? Those are kind of the buzzwords here. If not, they don't get speech at school. If they can do everything fine, like a stutter, for example, the kid stutters, makes great grades, does good on presentations, doesn't bother him, doesn't bother his peers, he's not getting therapy at school. They can't make an educational case, does not impact his education. But they could choose to do private speech therapy, either pay, out of pocket with their insurance, because he does want to, he wants to work on it, but it's not really impacting him at school. So that's kind of the 2 different ways that we look at it. Educational impact versus personal impact, social impact, or they choose to. So for adults or older kids, for example, you can choose to get accent therapy, to work on your accent, to not have one as much anymore. But it's not a medical need. It's not an educational need, because we know that those accents are acceptable. So that would be like elective therapy. You can choose to get that, but insurance or whatever isn't going to pay for it because you're choosing to get it. Does that make sense? So very, very child dependent once again. Jumping back to social skills for a second. One of the easiest ways to do it is with other kids. So find like here in Mobile, and I'm sure there's some in Auburn, there's like Dance Without Limits, Basketball Without Limits. There's a gymnastics class for kids with disabilities. So find those resources in your community where there are people that are trained to deal with kids with disability of whatever kind, where they can be with other kids and learn how to be in that group. Because once again, it's in context. We learn best when we see the thing in front of us. So it's hard to talk about, you know, say your kid had an incident on the playground and they pushed their friend because they got frustrated. If you talk about that 3 hours later, it's out of context. That situation is no longer right there. You can't say, look, Johnny is sad because you pushed him. Look at his face. His face is frowning. His eyes are crying. His body is sad because you pushed him. But what can we do because we made our friend sad? They can't, that out of context is just so hard. So that's why I love groups for social skills stuff. All right, y'all have any more questions? We got about 5 more minutes.
I don't see any questions. I just see, and I mean, forward them to you, the comments from the parents from excellent presentation. Thank you for this presentation. I wish you were my child's speech therapist. Very good presentation. So thank you to Dr. Hill, Dr. Drew, and Ms. Gutierrez for inviting this speaker. Awesome presentation. So it has, you know, people are very glad. I mean, I personally think that the way you explain it is parent-friendly language totally makes a difference. So thank you for doing that. I do not see any other questions. So if you would like to wrap it up, I don't know if you would like to share your email just in case that people have any other questions and would like to reach you privately, if that is okay with you.
Absolutely. I can post my email address in the chat. This is my personal email. Oh, I sent it directly to you. Hold on, let me send it to everybody. I would highly recommend that for if there are, I know I said this already, but if there are any professionals that are here, look into the bilinguistics. Oh, why won't it let me do that? Sorry, I'm trying to copy and paste and it's not cooperating. Bilinguistics is a great resource. Oh, and let me post also for parents that have Instagram. I think she may have a Facebook also. Let me look. There's a speech therapist that I follow that posts wonderful information about not only being a bilingual parent, but she is a bilingual speech therapist also. So I'd highly recommend looking her up on Instagram. I'm going to post her handle. Bilingual therapy. Bilingual therapy. So that's her her handle, screen name thing, don't recall that. And she has a lot of great resources. Highly recommend looking her up. I get a lot of information from her, and you know, reach out to resources in your community to find some support also, but she's really great.
Okay, so there is a question about a family that lives in the Mobile area, and their child is currently receiving speech services, but the speech pathologist only speaks English, and so the parent cannot really have a communication between both of them. So she would like to know, where do you work? I mean, and what kind of suggestions do you have for her to work at home with the child?
So all of the play that I talked about earlier is great for younger kids or early language learners in general, probably up to, you know, up until they're speaking, you know, 3-4 words at a time. But even after that, it always can be made more complex. I would just say if you'll email me, then we can kind of talk about what that would look like. My clinic is trying to set up a better system for our bilingual families, because word has kind of gotten out that I'm here, and but we're trying to figure out how to handle that in the best way. So please send me an email, and you can email me in Spanish. It's fine.
That is all I. Dr. Drew, I was wondering if you wouldn't mind putting the links for the survey For the ACDD, we would like to invite our parents to please complete the survey, as this is very important for us to fulfill the grant, the requirements, and also to provide them with input about what you guys are learning so that we could continue doing this kind of presentations. And also, Kelsey, I will be sending the translated Spanish version of the PowerPoint plus the English version to all people that sign up, and we will enclose the links of the resources that you share as well. And is there anything else before we close today's session, which was amazing?
I will also send you quickly, I'll try to find the stuttering resources in Spanish. I'm wondering if, I don't know, I'll find it and I'll send that to you, and so that can be included also.
Perfect.
Okay.
Perfect. Well, thank you so much. And thank you to our interpreters and our professionals and families. We appreciate you all being here. And then Ms. Jones will also be back on Friday to present. And as you know, we always get slightly different presentations. And so it may be beneficial for you to also attend the one on Friday if you found this one helpful.
So thank you so very much once again to Kelsey Jones for presenting today. We hope that you guys could join us back on Friday. Please share the upcoming training with other families and people that you serve, and we see you Friday. Have a nice day, everybody. Thank you to our interpreters.
Yes, thank you so much. So grateful for all of you.